I am so honoured today to welcome Professor Jayashri Kulkarni, Professor of Psychiatry at Alfred Health, Director of Her Centre, Australia at Monash University, and founder of Cabrini Women's Mental Health Hospital. Professor, it is an honour to have you with us today. I know you've dedicated your life to this work of transforming women's mental health. And so on behalf of our listeners, I just want to extend our deepest gratitude first and foremost.
Oh, well, that's lovely of you. Thank you so much, Shelley. It's actually a great privilege to work in this area. And I think what is really critical now is all that work, the research and the background to thinking about women's mental health at different ages. It's really important that we get that information out to the general public. And that's where podcasts like what you're doing, Shelley, are just so critical, because it's the missing communication bit for researchers like me, because that's not what we do. So I'm just delighted that you've taken up this topic, and that I hope many of your listeners will be able to take advantage from hearing this podcast.
I'm sure they will. And often here we like to talk about the joys of aging and how it should be an exciting time for all of us, and not to dwell on the past or who we were, but to really embrace what's coming in the future. And I'm learning to appreciate, for a lot of women, that's just not the case. The future doesn't look bright. The future looks very bleak. And perhaps a lot of women don't really understand the feelings that are going on inside. And I often hear use the excuse, and I do it to my teenage daughters too. I say, it's not you, it's your hormones. Don't think this is all about you. This is just something that's happening to you right now. And for us to speak to you and understand this a little bit more, I'm really quite excited about today's episode.
Fantastic. I think it is important to understand the impact of hormones on mental health, and the impact of the particular hormones we're talking about are the gonadal hormones, that estrogen, testosterone, progesterone group, that used to be just considered to be part of the fertility side of things, that they only just worked on ovaries, uterus, and maybe breast, but nothing else. Well, that's completely wrong. These hormones are potent brain hormones, and they do impact on how women perceive their environment, perceive the stresses, deal with the stresses and conflicts, and also a whole lot of other brain as well as body impact. So they're very important, and we have not paid attention to them until recently. So in some ways, though, what we also need to do is put the hormonal impact into context of what else is going on in the person's environment, as well as what has happened in the past, and then to come up with a better holistic approach for each individual to be able to equip her to go forward and have a happy, healthy aging time.
So there'll be a lot of women out there who have experienced mental health issues, and when they reach perimenopause, I'm imagining that just gets so much worse. And then there will be women who have perhaps never experienced any mental health issues but hit perimenopause. So all this feels very, very new. Where should we start today's conversation?
I think you've just started at exactly the right spot, that in fact at perimenopause, let's define that first. It's the transition into menopause is called perimenopause. The transition process is about a 10-year process. It's not a quick happens today and everything's done. It goes on usually between early 40s right through to maybe early 50s or even a bit later. So this is a transition process, and it's called perimenopause. And if we start right there, as you described so beautifully, there are two groups of women who experience issues in the perimenopause. One group who've already had mental health problems in the past, and then the other group who've never had anything, and bang, they suddenly develop quite a significant severe depression or anxiety or both. And the responsiveness to standard treatments can be very variable. So it is important to start in the perimenopause. So let's think about a bit more about the first group these are women who have experienced something in their earlier life. Now, our hypotheses and what we're working on is the role of trauma in the production of mental ill health generally in women, and the exacerbation of whatever has happened in the past when the woman hits her 40s, late 40s and early 50s. And what we think is going on is that, unfortunately, in our society, there is still a huge amount of trauma that women experience. And by trauma, I'm talking about all of the psychological issues, the emotional traumas, physical traumas and abuse, and sexual abuse. And so all of these things actually impact the growing girl's brain. Girls' brains are more sensitive to what's going on in their environment than boys' brains. Now, I don't want this to be a race to the bottom and go, oh, only girls and women suffer. No, we know that boys and men suffer as well, but differently. And that's the whole point. We need to understand, because women have not had a specific focus on women's mental health until more recently. So girls' brains are more sensitive to what's going on in their home environment. So they have a much greater antenna, if you want to put it that way, to emotional conflicts that are going on in the household. And it's different to say, yeah, mum and dad are having a fight, and it gets resolved and then everyone goes back to usual. That's normal, right? There's no such thing as the perfect family where people are all happy and sunshine all the time. That's only in some weird la-la land. But what I'm talking about is where there is continuous conflict and there's continuous, if you like, that sort of stern, critical comments that can be really undermining for a young girl. And she takes that to heart. That's one type. The other type is where there is a split in the family. Either one of the parents dies or leaves or something happens. And then you get the situation, if it's not negotiated or worked through, you can have the situation where this young girl feels sort of tossed between households, between different people, and that can be quite destabilizing if it's not dealt with properly. Okay, so that's another one. The other thing that we're also worried about is when young girls witness violence in the household. So this is where the parents, one attacks the other, and it's usually the male who's attacking the female. And if there's alcohol or illicit street drugs fueling this, then she's watching this, and it can have a profound effect. If, of course, she's a subject of physical violence as well, that's even worse. And if she's a subject of sexual violence towards her, that is horrendous. And unfortunately, in our society, it's still there. And it's often glossed over, or it's not recognised until much later. Or the worst is it's invalidated. So this is where we know, again, in the worst case scenarios, that the woman, she's now a woman, is telling us about retrospectively what happened to her when she was an adolescent. And she tells us this. And often it's accompanied by, I tried to tell people, but they didn't believe me. So it's a double whammy of awful things happening, but then not being believed. And that, Shelley, unfortunately, even in our lovely, wealthy society, is common. More common than your listeners possibly want to believe, but it is common. So that then has an impact on the developing brain of this young girl as she grows into adolescence and then adulthood. What it does in the brain is it alters the brain chemistry, and it alters the brain chemistry in such a way that it also has an impact on the brain hormones. So this is why this is a girl who is at risk of premenstrual depression as she's in the fertility age group when she becomes post-puberty. She has monthly cycles where every month there is a depression that happens pre-menstruation, and that's called premenstrual depressive disorder, or PMDD. It's quite a severe thing. It's not just a bit of crankiness and a little bit of irritability. It's actually a whole week of debilitating anxiety, depression, and brain fog. And that's one thing. And so this is a girl whose brain, or a woman now, whose brain is more sensitive to hormone blips. She's the same woman who's particularly likely to have a postnatal depression once she's a baby, because again, that's a big hormone change. So she's likely to have a postnatal depression, and she's very likely to have a perimenopausal mental ill health condition, because again, it's the hormone shift. In fact, the menopausal hormone shift goes on for 10 years, so it's a big ugly shift for some women. So our hypothesis and our work is to look back in terms of taking the individual's very careful story sensitively about what happened, because all those things that happened back there can have an effect now, even though she's 46 or 47. That can play out now, and it plays out biologically by what I've just described. That's through the hormone axis, through the brain chemistry axis, but also psychologically, as we know, many women, once they get to midlife, are kind of at the crossroads of what now. Do I keep doing the same? Do I change direction? And there can be some quite radical shifts that some women choose to make. Some for the right reason, some for the wrong reason. But, there's a lot that's going on in midlife. She's often the cheese in the sandwich, so she's got responsibility for older, aging parents. She's got responsibility for the younger generation, and especially if she's got adolescent kids, they're going through their hormone mush in the brain, if you want to put it that way, and she's going through her hormone mush in the brain. So it can be quite a difficult time.
At the Aging Project, we believe everyone should have the opportunity to understand their genes, and we've created a program to help you do just that. Over the past 3 years and 100 plus podcast episodes, we've interviewed world-leading longevity experts, many highlighting the power of genetic insights. But when we went searching for the best DNA testing option in Australia, we hit a dead end. If DNA knowledge is so vital, why wasn't there one trusted company offering the best test with the best insights? So we built it for ourselves and for our families and for you. We're incredibly proud of what we've created because we know that it will change lives, including yours. We've partnered with FitGenes, a world leader in genetic testing, to bring you Australia's most advanced, science-backed DNA program. It isn't just another health trend. This is a once-in-a-lifetime opportunity to discover your DNA and how to use that knowledge to make better choices. For the first time in history, we have access to the power of genetic testing, something no generation before us has had. So stop guessing what your body needs when a DNA test can give you personalized insights. If you're ready to learn and discover 200 healthy aging genes, join us for our free DNA webinar to learn why your genetic blueprint matters. Visit theagingproject.com to register. And because we want you aging well alongside us, we will send you our exclusive Stay Well scorecard bonus. This will land in your inbox just after the webinar. This is game changing. It's a resource that includes markers we want you tracking every year, starting now. It includes 50 blood markers, 5 critical health markers, including blood pressure and bone density, 9 general health indicators, and 4 mobility markers. This I cannot wait to share with you because it is life-changing information. Join our free DNA webinar, register today, and we'll see you soon. I'm imagining too that this group of women who are now sort of midlife would have possibly had medications prescribed to them through their youth and their 30s that I'm guessing, and again, I don't know, would be suppressing a lot of those feelings or medicating a lot of those emotions and hormones rather than working through those issues. So they've sort of been masked for a long time. And now we've got another eruption of hormones happening that possibly, the same drugs aren't working the way they used to.
Yes, there's a lot of conjecture about all of that, and you're right that in fact there is often a history that we see. Say the classic, I see the woman here, and I'm seeing women in a tertiary hospital clinic, so they're pretty unwell by the time I'm seeing them. Mm-hmm. But the classic background story is exactly that she had early life traumas. and was sort of deemed to be the ratty adolescent who would go off and be a bit promiscuous or not attend to classes or just not be diligent as a student, and then that affected what courses she got to do. She was sort of given this internal message that she's not good enough because of the harsh critical parenting style, that she carries that message. She then goes into a relationship with somebody who's not good for her, picking the sort of wrong sort of person in a relationship who then makes her life even more difficult, and so on. So you get the story often retrospectively, and along the line she will have had diagnoses like depression, or worse, a personality disorder diagnosis, which is absolutely unhelpful, and medications for all sorts of different things, psychiatric medications. We often see this is the person who in menopause everything gets worse, and suddenly she'll get diagnosed as having bipolar disorder, or even like lots of other medications that really can create a lot of side effects but without actual therapeutic effect. And that then means that we're left with trying to sort of work out, right, well, we have to peel back all these medications to see what is happening, and also then we have to deal with side effects, because often the medications have caused weight gain, and she might have a whole lot of self-esteem issues that she already had, and then they've got worse because she says, oh, I'm look at me again, that harsh critical self-talk, which is I'm big, fat, ugly, hopeless, etc., continually on a loop. So there's a lot that goes on and a lot that goes wrong. And so it is important, if we peel back, where are we going wrong as a society, if you want to think about it that way, is in the non-recognition and non-prevention of the early life trauma. I was really, there's a lot of activity going on. There was a march recently in Melbourne, with women saying stop the violence against women.
Yes.
And that is critical. We need to stop the violence against women. And by that, I include the very hurtful emotional violence, which we don't pay that much attention to. But that is very hurtful. And so, again, we see many girls who have that difficult early life in their households, and then they have bullying in the school ground, and so on and on and on it goes. So we need to be preventative in our attitudes, and have much more kindness in everything that we can and offer our children, because that starting there is going to be a really important investment in female mental health and male mental health, I've got to say, but just again saying that girls' brains are just that more sensitive.
Yes.
The other thing is it's not diagnostic, and it's not necessary that everything that's depressive is due to a serotonin chemical imbalance, which is then a prescription for an antidepressant. That's not the case. Yes, they have their role and a place for antidepressant therapy, no doubt, but not everything that she's going through can be dealt with in that way. And a lot of it is actually about, talking therapies or changing the life circumstances, eating better, perhaps, loving oneself a bit more, engaging in such things as some pleasant activities. Many times I see very, very, very stressed women who are trying to do everything for everyone, and I ask the question, what are you doing for yourself? And you just get this big silence, and that's so sad. So I get out my prescription pad and prescribe half an hour of fun every day. It's not much to ask. Half an hour of fun. And it doesn't matter what the woman says. I've had people say things like, what is half an hour of fun for you? And she goes, I don't know.
I don't know.
And that's so sad. And so again, why are we in this situation that we have all of these wonderful things around us? We've become much better at not having no food to eat. We're not in a society where we're having to fight for a roof over our heads and enough food on the table. Mostly we've got that under control. But then what is going on that the women I'm seeing can't tell me what half an hour of fun they're having every day?
Jayashri, this could be possibly the most important message today. This is coming from you as a professor, that we must all find some joy somewhere every day.
Yes. And it's not, it's not about you have to go off and have your nails done or something like that. I'm just saying, where is your joy? Because, again, we know that playing with a child, having a creative play time that you like is your joy as well, right? But you have to feel it. Whereas what I'm sort of seeing is a whole lot of, I've got to do this. I have to do this with the child. I've got to read this to the kid. I've got to get the kid literate before they are 5. I've got to get them to swimming. They've got to be, an Olympic athlete before they're 10. I don't know. There's a whole bunch of have tos. So sometimes it's like, where are the want tos? Not just have tos, but where are the I want to spend half an hour having, a picnic with my child, just being there, not being on my phone, trying to keep my job going while I'm at a picnic with my child. It's the being present for some part of the day. Not, you can't do that endlessly. I know everyone's got all sorts of responsibilities, but I still think we can carve out half an hour a day of enjoyment, of joy.
Well, having you tell us that this is so vital for our
Yes.
neuroplasticity is extraordinary. So we are taking absolutely your word on this, and we will find the joy. I remember even the other day I tried to do a cartwheel with my girls, and I used to be I used to be quite the gymnast, to be honest. And that in itself, the basic attempt to do that had us all in stitches for a very long time.
Absolutely. That's the thing. It's a belly laugh. We
Yes.
need to have more belly laughs.
We do. We will bring that to the platform. Thank you very much. So this is for all women,
Yes.
for the ones, as you say, that have been diagnosed early and perhaps have had treatment, medication, professional guidance up until this point. Things are also going to be very different for them in perimenopause and menopause. For those women who've never experienced anything and are now finding themselves doom and gloom, anxiety, the shakes, not wanting to leave the house in social situations, and I'll put myself there. I've been in social situations my whole life, and now I find them quite confronting.
Yes.
But I am aware through the work that I've been doing here at the Aging Project that, again, this is not me. This is my hormones.
Yes.
You're perfectly safe. But for some, this could be an enormous shift in their lives and in how they choose to then go about their lives. They become more reclusive. They pull away from friends. They don't want to be in social situations anymore, which then snowballs, doesn't it, into more and more problems for them.
Absolutely. And again, I mean, this is the group that I see who actually also have, worsening mental ill health. Um, you raised anxiety, and that's important because we call it perimenopausal depression. But I think if I could have my time over again, I'd actually call it perimenopausal mental ill health because it's not just a straight depression. We all know about straight depression being sadness and but again, it's got attached symptoms like not having enough energy and just not being able to think clearly and not finding any pleasure in anything. They're the features of depression, tearfulness as well. So that's there. But additionally, in the perimenopausal age group, the kinds of symptoms that women describe will often start with big anxiety.
Mm-hmm.
And women have described panic attacks, which they never had before, or that they've got anxiety over, just as you described, things that they've done, X million times in their life before. Like I have one of my patients is a woman who's a lecturer in the university, and she's given squillions of lectures, and all of a sudden she froze. She just couldn't go on with the lecture that she'd given so many times before, and then she had a panic attack in front of the class of students and had to sort of run away, and then to get her back into her role has been really difficult, as you can imagine.
Mm-hmm.
And again, the reason behind this sort of anxiety and panic in situations where it's not new is related to the hormonal shift that's going on in the brain. So, coming back to our 43 to 45-year-old, starting there, the estrogen and progesterone levels start to fluctuate, and they fluctuate quite a lot, as in big fluctuations. And this is why sometimes people say, for 2 weeks, I was just out of it. I just didn't know what I was doing. I was really anxious. I just couldn't do anything. I couldn't think through things. And then all of a sudden, I woke up and I was fine. And so people then sort of write that off as, I don't know what that was, but it can happen, and it does happen again, because this is a fluctuating change in mental state or mental health, because of the fluctuations in the hormones in the brain. And that's the difficulty, because you can't pick it up while it's happening. There's no blood tests that can be done that will pick it up. And many times the woman will go, I don't know what's going on, but I have an inkling that it's something to do with my hormones. They'll go and see their primary healthcare doctor, and the doctor will do an ordinary blood test to look at hormones, and it'll come back normal, which of course it is, because the body hormones are normal. But this is going on in the brain, and we can't get to measure the brain hormones, which are, shifting the brain chemistry. And that's a problem. So you've got no test to back up your gut sense that this is your hormones.
Right.
And then people start to look for other things, and especially with the on-off depression. So for 2 weeks, she's feeling panicky, anxious, depressed, not herself, maybe snappy, irritable, ragey, angry, all of that's going on. And then 2 weeks later, she's fine, she's happy, she's herself. And so people then start to think, oh, this must be bipolar disorder because it's fluctuating.
Mhm.
So then out comes all the bipolar drug treatments, and it's not going to fix it. In fact, it'll make it worse, because now there are side effects of different medications.
So this has nothing to do with your actual cycle, like with, PMS, that the week before you're going to be grumpy, blah, blah, blah.
Yep.
But because your cycle is changing so much in this period too, you can't say, oh, I know that I'm going to be anxious 2 weeks before my period's due, because again, we don't know when or where that may happen again. There's no real pattern to these hormone fluctuations in the brain.
Correct. And that's exactly the diagnostic problem that the woman herself and her doctors are going to have, because there's no sort of real pointers anymore as to what is going on. But it's interesting. The woman herself will have the answers. So we must never, and this is important for all the health practitioners to not discount when the woman walks in the practice going, I think it's my hormones. It's not about saying, well, you're too young, you're only in your early 40s, so that's not it. That's exactly right. If she's saying, I feel like this is a new thing, I don't have any new stresses in my environment, I'm still doing the same stuff in my work, things are the same at home, etc., but I think it's in me, there's something in me, I think it's my hormones. It would really be good not to invalidate her self finding, but to actually work further on that hypothesis with her. Because at that age group, you can easily manipulate adding in a hormonal treatment.
Recently on the podcast, we met functional dentist Dr. Stephen Lin, who spoke about the benefits of a few products like vitamin D with K2, magnesium, mouth taping, and organ supplements. So over at You Must Try It, we have these available for you. We love the Primal Energy Women's Formula because of its quality ingredients and its tastelessness. If you missed the episode, The Future of Dentistry is here. Check it out after you finish this one. And for any of the supplements mentioned, like the ones above, you can visit youmusttryit.com to learn more. So, yes, surely it's a given. If you are even late 30s, because I know a lot of women will start perimenopause or early, and we've had conversations with women that have had surgical menopause. They've had a hysterectomy and suddenly they're in menopause.
Oh, that's a really rugged menopause,
and they're still not able to access, perhaps if they don't have a great GP or professional team behind them, someone that says, well, let's just sit back and have a think about this for a second. This is your age group. This is common. This is normal. how do we work through this? And again, I know we're speaking to a lot of women who HRT hasn't been offered or isn't an option for them, or they're not interested and they want to get through this stage on their own. What are your feelings on that? What is, I guess, hormone therapy from your professional point of view?
So hormone therapy includes all of it, a whole lot of things, because the pill, for example, the contraceptive pill, or any of the hormone contraceptives and the IUD or the rod that goes under the skin, they're all hormones and they're all a form of hormone therapy. So sometimes in our practice here in the clinic, that with the younger age group who are presenting with her intuitive sense that there's something hormonally going wrong here and the history, so we do take a very careful story of what has she got and what has she noticed. The first step is you can use the pill to help see if that will control some of the fluctuations. Not any pill though. There's some really nasty pills on the market, so we only use one, which we've researched as particularly good for the brain and not one of the nasty ones. But again, it is something that is a collaborative effort between the woman who will tell us what she thinks is happening in her own body and brain, and also what she would like to try as a treatment trial. And some women opt for natural, or they will go to their naturopath and get a paste of a certain hormone or whatever. That's okay as long as you know what's in it. There are some pastes that you don't know what's in it, and that can be a problem. But some women will go to the health food shops and get over-the-counter preparations of things like red clover or black cohosh and so on. Sometimes there's just not enough hormone in those things. It's like very small doses. I mean, it's safer, obviously, to have a prescription and a doctor who's monitoring other aspects of health and who knows what other medications the woman's taking and can look at all those interactions. And also, every woman should have regular pap smears or cervix health screens, and then as she gets older, breast screening as well. That's just a given for every woman.
Mm-hmm.
So, there are many hormones, starting with the contraceptive pill or contraceptive hormones. The next phase is moving into more of what was called HRT, is now called MHT, menopause hormone therapy.
Mm-hmm.
And MHT has a huge number of different things. So it's always a worry when someone comes in and says, oh, I tried HRT and it didn't work, because there are so many. Did you try this? What dose did you try? What type did you try in terms of service, in terms of delivery? There are patches, there are gels, there are tablets, so each one of them has their own good and bad effects. And so again, this is, unfortunately, it is a trial and error, because you can't just kind of, be lucky if you suddenly landed on the one that worked for the end of everyone, but it doesn't work like that. Everybody's different. Mm-hmm. So this is the art of medicine rather than the science of medicine, where you work together to try a bit of this. It's like making a curry. You'll put in this spice and that spice, and you'll try a bit of that and try a bit of this. But, in some ways, I think it's very empowering for the woman to work like that with her doctor, because she's the one who's got the information about how she's feeling on a minute-to-minute basis. Mm-hmm. And so if you are not taking that into account, then you're really missing a really good opportunity to have personalised prescription for that particular individual, which may not work for the next woman who comes in the door.
But the purpose of it all is to even out the hormones, to be the way we were in our 20s and 30s. That's the goal. That's what we're going for.
Not the 20s and 30s, because the brain and body are changing anyway. This is not fountain of youth. This is about giving the woman some control over the hormone chemical interactions, such that she can get on with her life in her love relationships and her work relationships, and outputs from all of that. So it's not a fountain of youth, and we must never think like that, because there was a time when people used HRT for getting their skin to look good or whatever. That's not it. This is about just saying you should be in control of you. so that then you can make your decisions and you can get on with stuff. This isn't the problem of the fluctuations in somebody whose brain is sensitive to those fluctuations. Not every woman's brain is sensitive, but if your brain is sensitive, then your actual functioning may be impaired or impacted. And that's what we want to be using hormone therapy for.
I
Just to give you
understand.
a tool to help you get back to you at
Yes.
this age.
Yes, and that's why some women you do see cruise through
Yep.
perimenopause,
Yep. Leave them alone.
seemingly so,
Leave them
and
alone.
happy
Let them
days
get
for
on with
you,
it.
and the
Yep.
ones that are having a really rough ride,
Yes.
there are options out there for you to find a new normal for this period of time. Once menopause, and I'm not going to say menopause hits, once you are in menopause, which as we
Yes.
know is diagnosed as a year since your last cycle. So you don't know it until you get there.
Yeah.
um, are your hormones then on a level playing field? Do they even out again? Or is menopause therapy something that you then continue to the end of time?
Right. So there's no definitive answer to that because it's different again for different women. So usually it once the period has stopped for a year and there's no more bleeding, then after about another 3 or 4 years, we think the brain hormones settle into a lower level than they were during the fertile years, but they're not fluctuating. So the brain likes things to be on an even keel, like the hormones to be on an even keel. This is, again, why the cyclical stuff is difficult. And then when the cycle goes into sort of free fall, that's even more difficult for the brain to handle in the vulnerable woman, right? But some women found that they need the additional hormone from the outside, as in MHT, to help them keep going. And that's okay too. The counter factor to why people should stop taking the hormones is if their physical health becomes an issue. So that if there is some other body issue that happens along the way with aging, like a cancer that is not because it's not going to be a cancer caused by the HRT, but it just is something else that goes wrong, then it might be that the HRT is not to be continued. But it's not because you go to menopause is happening up until age 55, and then at 60, everybody must throw away their HRT. It's not like that. And that's, in fact, unfortunately, that there are so many myths and weird messaging about this whole area that so many primary healthcare physicians do that. They see patients, oh, yes, Mrs. So-and-so or Ms. So-and-so, you've been on this for now, oh, you're coming up to 60, we better stop that. And then I see people whose cognitive functioning or brain sort of higher level functioning just takes a dive. And 60 is young. I'm sorry, but 60 is young.
Oh, yeah, it is hella young. Yes, it is.
So, we need to also keep in mind that with our prolonged lifespan now, most women are spending a lot more time as postmenopausal. So,
Functioning in the workplace and
and they're
just
the
in the
seniors.
world, full
Well,
stop.
they're the seniors in the world. They've got the most experienced positions because they've been in it for longer. So we need them to keep functioning at top speed. And that's the other interesting thing that, we do see a lot of women who take a back seat in their careers when they get to their 50s, mid 50s or even. Because sometimes this issue of brain fog hasn't been addressed. And so we see women who will step out of their sort of high-powered executive role and take a lesser role or not go for a promotion. And then you've got that superannuation differential. We know that men's superannuation is higher than women's. And this is one of the factors that women are dropping out of the workforce because of cognitive brain issues related to menopause. And that's not fair. That's really not fair.
Well, it's not fair on anyone because even in the workplace, you're then missing out on this incredible wisdom that maybe during the brain fog she doesn't access quite as well, but we know it's there.
Yes.
There's years, and I mean, you've been doing this work now for 30 years, and I can imagine, well, I can't really even think what it would have been like being a woman in the 80s when none of this was even ever considered,
No.
spoken about, researched. Like, how far has your work come since you began in this
Look,
space?
I'm thrilled at the acceleration of the focus on this. It's still not resourced well. So when you look at the funding for research for women's mental health, it's right at the bottom of the barrel, and we get very little. Youth mental health gets significant funding, and sometimes I cynically go, well, hang on, if you want to fix the youth, help their mums. Because when you've got a really fiery mum, she'll lay down the law to that adolescent and get things back under control for them. But it's an issue. But what we're doing is understanding much more about the brain and understanding the role of hormones in the brain. And I don't want to medicalize menopause. This is not the aim of this, right?
Mm-hmm.
This is not about, and as I said to you, the woman who's nicely flying through perimenopause and she's making her own decisions about, I'm going to do this, I'm doing that, good on her.
Mm-hmm.
Don't go anywhere near her. We don't need to be involved with her. But I'm much more worried about that significant proportion of women who have been functional, have been enjoying their life and being a good parent and being, great in the workplace, and all of a sudden that both areas get impacted adversely, because we need her back in all of those domains to be firing. And that's where treating her with a standard antidepressant, making a diagnosis of this is just standard depression, is not going to make that person well enough that she'll pick up all the pieces. She'll get some improvement, but it won't be enough. Or worse, saying that, she has a personality disorder or some other, weird diagnosis that doesn't fit, is going to make her life worse. And then those around her who depend on her, their lives are impacted adversely as well.
I think it's become really clear that everyone is on their own roller coaster. And some of us might be on the baby one down in Toontown with a couple of little bends and a few little turns, and others are on that corkscrew that is going around and around, and you feel like you're never going to get off. And I think if we all understand that everybody's ride is very, very different, and as you say, no judgment either way, we're just here to provide information so that everyone can make the most educated decision they can, and to feel like they can stand up and say, hey, I need help. This isn't working. It's not me. It's my hormones. Let's try and find the best solution for the individual, for that person. We should all be trying things, and I know supplements are something that I'm very passionate about, in the fact that sometimes our diets just fall short. Can that often change, obviously, in perimenopause and menopause? Are we just not absorbing things like we used to? Is this something that we should all be getting on board with?
Look, there's a lot of interesting body changes that happen because, again, these hormones, I focused on the brain, but I could easily talk about what they do in the gut. And, we know that there is a lot of impact on bone health as well, and cardiovascular health too. So they're quite ubiquitous throughout the body and brain. And yes, it would not be surprising if there are changes that occur. We know that, for instance, estrogen is one of the potent immune system modulators. So the immune system governs, obviously, whether you succumb to every cold and flu virus that's out there, or whether you fight it off a bit more strongly. And we know that the hormonal world controls that as well. And so what we see with these fluctuations and changes that happen is sometimes women develop very what we call autoimmune conditions like fibromyalgias, or irritable bowel syndrome. And there's malabsorption there, of course, with irritable bowel syndrome, that nutrients are not absorbed very well. There can be changes in response to foods. So I've had women say, I used to happily eat bread and celiac, and all of a sudden I just can't. I come out in this rash. So, again, there are allergies, new allergies, because that's the immune system. So there are many changes that can occur. And we don't understand all of them by any means, but we should not discount that which we do not understand. So I really hate it when people go, nah, that's got nothing to do with it. Do you really know that's got nothing to do with it? I don't think you do. So let's
My
keep
goodness.
our
So you're
eyes
not
and
even going to relate the fact that you're anxious and having panic attacks to the fact that your skin is now itchy whenever you eat tomatoes. Like you're not going to connect those two. So you're seeing your dermatologist, you're seeing your GP, you're on medication for something that might then be increasing your reaction to tomatoes. You just don't know.
yeah, yeah. But I think it's what we need to get to is thinking of the whole
Mhm.
body, brain, environment. So a holistic approach is going to be the best thing we can do in medicine. And I'm talking to my medical colleagues, but it's like, I think this business of silos, that yes, you go to your gynae for just bits in the bikini world, and then you go somewhere else for looking after your migraine, which, by the way, gets worse with perimenopause for those migraine sufferers. Then you go to your psychiatrist who's busily diagnosing bipolar disorder because you're fluctuating in your mood, and none of them are really putting all of it together. Whereas a good GP is worth their weight in gold because they can sit there and they go, okay, that's probably connected to that, is connected to that, is connected to the fact that this is a woman who in her early days was bullied mercilessly, at school and still carries the negative self-talk and self-image. And so all of that's got worse as well. It's absolutely imperative that we think again about how we practice because it's all connected.
Professor, we're taking control of our own health here. We're doing everything we can to empower ourselves with information, with knowledge, with extra research. You've developed a screening tool, this
Yes.
MenoD. Is
Yes.
this the place for us to start, just to get that baseline of where the hell am I today and how do I move forward from this point?
Yes, absolutely. It's a rating scale that can be used as a self-rating scale, or it can be used by, in conjunction with a doctor or clinician doing the rating scale with the woman. But it's worth looking at because, and again, I called it MenOD, the D standing for depression. If I think it's a bit of a misnomer because it's more than depressed mood. It's anxiety. It's weariness, like you may have experienced that tiredness in first trimester pregnancy. It comes back again. I've had women say things like, I haven't even got the energy to lift my brush to brush my hair. The self-esteem, can plummet. There's rage, the anger that sometimes people have not been able to express where it should have been expressed can come out where it's more difficult, and so on. So again, it is a self-rating scale, and sometimes women have used it as a sort of monitor for themselves. Like they'll do it once and then come back to it in 2 weeks' time and see how they're traveling. It's quite malleable. So again, it's one of the educational tools. There's a lot more about menopause that can be resource kits. The Australian Menopause Society have a toolkit on their website. International Menopause Society has stuff. Jean Hales as an organisation has information. So it is important to arm yourself with information, but never, ever, ever underestimate the I feel, because you don't get to 45 or whatever without knowing something about you, and you live with you. So it's really important not to invalidate the self intuition about something is wrong. And if you think it's your hormones, then probably it is your hormones, because so it's really important to again empower women to feel confident to be able to say, nah, it's not bipolar.
As you said, there's no blood test for brain health. You can test for so many things, but there's nothing we can do for that except, as you say, being honest with ourselves about how we're actually feeling in the brain. Is there any genetic testing available to show how our brains work, or how some of us may react differently or be more susceptible to mental illness than others?
It's a very, very good question. And what we're doing, and it's still very early research days, is working on exactly that. One of the things we're doing is working on that. What I'm trying to think about is there has been a gene isolated for PMDD. That was the work of Dubey, D-U-B-E-Y, is the clinical scientist who did that in the US in 2019. And so it's very recent. So that gene has been isolated in 50% of all women carry that gene, but not, of course, 50% of women don't have PMDD. It's about 15% or 20% who have PMDD. What we think is, and what Dubey described, is that it's a gene environment complex. So you can carry that gene and be totally fine and not have PMDD, but if you experience trauma, and usually we talk about the two-hit trauma, so two traumas, then you develop PMDD. And one of the most common traumas that women have is a traumatic childbirth. So she might be carrying an emotional scar from early life, and then she goes through and she has a traumatic childbirth. In a lot of ways, there are some horror stories of deliveries and so on, and then bang, she develops the PMDD on a cyclical basis. And as I said before, that's the woman that you would predict is going to have a tougher menopause. So I'm also trying to get some funding, and again, sorry to be whinging about this, but it's really hard to get funding in this area of women's mental health. To look at whether perimenopause depression has got that same gene expressed perhaps differently, but is there a carry through? So that's one thing. We're also working to see if we can get a way of measuring the hormone fluctuation in the brain. We can measure in the body. You can take a blood test, standard ordinary blood test, but it won't tell you exactly what's going on in the brain. So we want to use other modalities to see if we can get that, because I get really annoyed by mental health in the sense of we have not advanced the field the way other fields have advanced. I look at my cousins working in neurology. The people who have had strokes, they've done brilliant treatments for strokes. When I was a medical student, if you had a stroke, that was it. There was nothing much you could do.
Professor, you and your cohort are working hard for us. It is our turn to work hard for you, as you say, to advocate. And we're starting at the very beginning with domestic violence and making sure that future generations are not subjected to that as witnesses or as victims themselves. A great place to start for everybody's mental health in the future. Advocating for women's health is an extraordinary one. And again, I think we're all now standing up for ourselves. This generation has a lot of work to do, but led by yourself and the incredible people working in these fields. We are here for you. We're looking after ourselves, which is a big one. We're asking the questions. We're taking charge of our own health. And hopefully that's helping the GPs and the professionals out there to know that they're not doing this alone, that we're all on board and we're all pushing for something better for ourselves. Of course, we're going to find some joy. Now, everyone, after they listen to this, no matter where you are, I don't suggest you go and try a cartwheel. You're going to pull something, you're going to do some damage, but find that opportunity to have a little giggle or a belly laugh, or as we know, human connection goes so far. So ring a friend, have a chat, reminisce about the old times and have some laughs, but find some joy in your life. We're doing all the other things. We're sleeping well. We're getting rid of the caffeine and the grog where we can. We're trying to look after our nutrition. But we're also now giving ourselves permission to say, hey, my ride is a little bit different from yours, and that's okay. I have to find what works for me. And Professor, we are so, I guess, just in awe of what you do, but also glad that there are incredible professionals like you out there for us to lean on. So thank you very, very much for your time. Do not give up. We are here behind you the whole way. As always, the Aging Project podcast is for educational and entertainment purposes. Always seek medical advice from a qualified practitioner.